Hi, I'm Dr. Duff Sprouls with Space Coast Cancer Centers. I'm making this video to help you understand how we fight chemotherapy-induced nausea and vomiting. This is a very important subject to most people because that's the most feared side effect of chemotherapy is nausea. This is something that you need to understand, which is the purpose of this video, and you need to know the names of the medications and understand the how and when to take them so they can be effective to work for you to prevent the side effects of chemotherapy. The four categories of the medicines I'm going to talk about have to do with tranquilizers, the serotonin agonists, and the NK1 inhibitors, as well as steroids. All this is quite technical, so I'll try to keep this in layman's language to explain what we mean by this. The first category has to do with tranquilizers. These are actually very important because most people, if they get nervous enough, they'll throw up. People with anxiety, they throw up all the time. That's the flight or fight response in humans. If my stomach's full and I'm threatened, I'll vomit right away. That way, the decks are cleared for me to run away. Obviously, I'm not going to stick around and fight with anybody. This feeling of anxiety, of tension, is taken care of with a medicine we use all the time called lorazepam. The trade name is called Ativan. I think most people have heard of this before. It's a cousin of Valium. This comes in a pill, and we often give people pills to take before they come to the office to keep them relaxed. This helps prevent anticipatory nausea. We almost always give Ativan as an intravenous injection before any stronger chemotherapies because we want people to be relaxed so they don't throw up from that. 5-HT3 inhibitors. The next category of medications are really a godsend for chemotherapy. These were invented about the time I finished my fellowship 20 years ago, and they're technically known as the 5-HT3 inhibitors. I'll go ahead and tell you the name of the medication that was invented then. It's called Zofran. Its generic name is ondansetron. You probably need to know that one too because now it's generic. When it was first invented, it was $25 a pill. Now you can get 30 pills for $10, about 35 cents a piece. These medicines stopped almost all the nausea problems we had back then, and it's still a cornerstone of treatment. Almost everyone who has chemotherapy will have a prescription for Zofran prior to starting, so they can have this at home in case they need it. Some of the other medicines in this category that have been invented subsequently are used in our chemotherapy suite all the time. The newest one is called Aloxi. Aloxi is given intravenously and lasts for about 3 days. We regard it as an excellent medicine with almost no side effects. One of these same medicines comes in a patch called Sancuso. The patch is worn for 3 days and has the same benefit for patients who are on longer chemotherapies. Works like Aloxi or Zofran, but it is on the skin in the form of a patch. Some of you will need this.